I'm very happy to report that we had our first sub-Q ICD implanted at Sinai-Grace Hospital. I've been here for about 14 years now. We have been able to implant newer and newer technology over here, bring new technology for treatment of heart disease patients. We did our first bi-V-ICD in 2003, helping patients with advanced heart failure. We have been doing atrial fibrillation ablation for over 10 years, which affects about 5 million people in this country. And today we did our first sub-Q ICD. In this particular patient, we had no access site left because he had infections before, and we have taken out the traditional defibrillator in this patient. For the last 1 year, he has been using something called as a life vest. So for him, it's a life-changing measure, because that way he doesn't have to wake up middle of night to take care of alarms on his life vest. So it's going to make a huge difference in his quality of life. He had no other options. The defibrillator works similar to an implantable Cardioverter-defibrillator with a lead within the vein. So instead of having a lead inside the heart, it's a lead that is outside the heart. So the wire goes underneath the skin along the left side of the chest bone and breastbone, and it senses the activity of the heart from outside the heart, not inside the heart. So when it sees that the heart rate is fast and rapid, it gives an electric shock and resuscitates the patient. It's like having your own 911. Even if it goes off once in the next 4 to 5 years, it's going to add several years to patient's life. So usually the risk of sudden cardiac death is about 30 to 40% in patients who have heart failure. And there are a lot of patients with heart failure around that can potentially benefit. Comes in very handy for young people. Comes in handy for patients with renal failure, which a lot of our patients around this hospital has. So I'm very excited to offer this new technology at Sinai-Grace Hospital. So it's going to make a lot of difference.